This is Vince Lara at the College of Applied Health Sciences at the University of Illinois. Today I spent a few minutes with Keiko Ishikawa of the Speech and Hearing Science Department to discuss her research on voice disorders and helping people with dysphonia communicate better. My first question, did you always want to teach?
Well, this kind of came with my choice of job, I always taught. I started out actually as a voice teacher. I went to a music school, and before I went into speech pathology, and I was a voice teacher for many different individuals back then. So it was not a classroom teaching, but that's how I started out as a teacher. And as you go through the PhD training, it just came with the job, and I discovered I really love teaching and find it very rewarding.
Now, was that in the States that you were teaching? Where were you teaching?
Yes, back in New Jersey.
Oh, okay. Gotcha. And so what kind of voice teaching were you doing, like for singing?
Yes.
Oh, interesting.
So I have 2 master's degrees,
Okay.
and one is in speech pathology, and another one is master's in music, in voice performance and pedagogy. And so that was a classical singing. I sang myself and then taught opera singer to be.
I often ask faculty what inspires their research. So what inspired you to do what you do?
Okay, so as a clinician, I worked in Mount Sinai Infirmary in Boston, and I was a voice specialist there. And coming from music background, I was all about, okay, let's make people's voice cleaner and prettier, and just get what they're wanting. So that's what we do. But then I realized that the people who come to my room said, Keiko, I don't care how I sound, I just need to talk. That's when kind of, people are not really here for getting pretty voices. I mean, there are individuals who are also after that, but majority of my patients were looking for the way to enhance their communicative ability. And I just had no way to measure the aspect of their disability. So these people are chronically hoarse, struggling to talk in noisy places, which today's environment everywhere is pretty noisy, like restaurants, classrooms, bus stops. We are exposed by noise all the time. So these individuals are struggling to get through their day because they cannot be heard and understood in these daily environments. So now, as a clinician, I had no way of measuring their struggles, which is a problem for clinical outcome measurement. And so I don't know how effective what I'm doing, and how much of a struggle these individuals are facing every day. That inspired me to look into the intelligibility problem in dysphonic population.
Now, you spoke about how your research focuses on voice disorders affecting speech intelligibility. So what are some of the challenges of people who have voice dysphonia, which is, they basically have hoarse all the time?
Hoarseness.
Yes.
So hoarseness, obviously, it makes you sound like not yourself, and people may ask, like, are you sick?
Right.
Or, can you speak up more? And then these are also, for children, there's some data saying that the teachers perceive these children to be different from other healthy children. So just because of their voice, that they are somewhat stigmatized, and that is something to think about as well.
Do they associate it with a learning disability?
Not necessarily.
Okay. Now, the way we communicate today, meaning email and text, does that make it slightly easier for people who have chronic hoarseness to communicate?
That is one of the means, of course, that they can use that. I actually recommend that clinically when they are unable to use their voice, to use text, email, whatever that doesn't use voice. However, that doesn't really resolve the problem of daily things that they need to do. So everybody needs to go to restaurants for enjoyment, as well as the job that you need to do this for your occupational reasons. And if you can't do that, have a breakfast meeting with your customer, that is a problem.
Absolutely. Now, what led you to the University of Illinois?
Well, University of Illinois is a research-one university.
Yes.
This is a very research-intensive university. That I was always wanting to come to this type of institution while I was getting my PhD. Just happened to have an opening, and it was very attractive in terms of collaboration with the computer science and engineering. Some of those things helped me advance my science in my lab. So I chose this place thinking that this is the best environment that I could progress in my research program.
So, are you working on something that you're particularly excited about coming up?
Oh, many different things.
Okay. Anything in particular you want to discuss?
Sure.
Okay.
So one of the things we do here is to automate speech evaluation. So, for example, as I said, people with dysphonia have a problem in noisy places. And this is very difficult to judge in a clinical setting because clinical setting is quiet. You are usually with the patient without the noise in the background.
Sure.
So for us, it'll be really good to have some sort of software that measures these challenges. And to do so, we have to have some acoustic-based software, and we are in process of developing that in collaboration with other labs. So one of our activities that has become very fruitful was to open free voice screening clinic, and this was supported by Provost Faculty Retreat Grant as well as the CITL, Center of Innovation Teaching and Learning.
Right.
And this funding allowed us to again open the free voice clinic at the Speech and Hearing Science building, where we welcome anybody who's concerned about voice or just want to have a wellness visit to check what their voice vocal folds look like.
So anyone can come in?
Anyone can come in, and we do this every Friday.
Oh, that's
and
great.
so, our students in the department also get to learn from this clinic. They get to interview the participants as well as watch me perform endoscopy and learn about anatomy and physiology and pathology of the voice disorders. So this has become a really good activity, and we were overwhelmed by the number of interested parties across the campus. And we realized that, we are thinking voice is important for teachers and also vocal performers. But what we didn't really realize that, yes, every faculty member teach and talk and present. And so everybody was interested in the voice problems. So we are now fully booked until February.
Wow.
Yes. So, we are very fortunate to be given this grant.
My thanks to Dr. Ishikawa. This has been A Few Minutes With.